BioRx presents biopharmaceuticals versus pharmaceuticals. The word pharmaceutical comes from the word pharmakeia. Pharmakeia is the Greek word meaning the use or administration of drugs, from which we get the word pharmacy. Pharmaceuticals are considered to be small molecule drugs. Examples of pharmaceuticals include aspirin, Lipitor, Plavix, Crestor, and Humira, with the first blockbuster pharmaceutical drug being aspirin. Biopharmaceuticals are largely protein-based molecules that can be up to 100 times larger than so-called small molecule drugs. Unlike pharmaceuticals, biopharmaceuticals use biological systems. The first biopharmaceutical was insulin that was developed in 1982. A pharmaceutical is anything that can help in the treatment of an illness or ailment, while a biopharmaceutical is a drug that has been specifically engineered through biotechnology to help treat a specific medical problem. Pharmaceuticals are cheap and are generally easy to manufacture. However, they aren't as specifically focused as biopharmaceuticals and as a result aren't as effective. Biopharmaceuticals are specific and very effective. However, biopharmaceuticals are also very time-consuming and expensive to produce. As with most projects in biotechnology, there are controversies and challenges with biopharmaceutical use. Biopharmaceuticals in the area of genetically modified organisms and the environment face engineering challenges. Genetically modified organisms have been altered to produce medicines and treatments. The most common example is genetically modified bacteria to produce insulin for diabetic patients. In the past, insulin was taken from the pancreas of animals such as cattle. Today, most diabetic patients get their insulin from this sort of genetic engineering. Another major issue is the possible contamination of transgenic plants and organisms with unmodified plants and organisms. For example, if a plant that has been genetically modified gets released into the wild and coexists with the natural plants, it can potentially create superweeds that disrupt the surrounding ecosystem. Another engineering challenge lies with the fact that there are very few drug candidates that make it through screening and eventually find their way onto the market. It has been said that only about 5% of drug candidates get onto the market. This is because each candidate needs to spend a lot of money and resources committed to develop the drug. Some say that the future for biopharmaceuticals has a very high potential and is definitely here to stay.